12 signs point you towards throat cancer, and solutions exist for each symptom. Keep watching to uncover these signs and solutions. Throat cancer is a prevalent health issue that often goes undetected until it's too late. Early detection can dramatically shift the odds in your favor, potentially saving lives. But how can you spot the signs early on? What solutions are available? We'll delve into each of these questions, providing you with insights that could be life-changing. So, dive in with us to uncover these signs and potentially save a life. A persistent cough that doesn't go away might be more than just a cold. It could be an early warning sign of throat cancer. It's not your typical seasonal cough, it's persistent and often accompanied by a hoarse voice or difficulty swallowing. If you or someone you know has been dealing with a cough that lingers for weeks, it's time to consult a healthcare professional. Early detection can make all the difference. Next time that cough lingers, remember it might be more than just an annoyance. Is your voice sounding different these days? It's quite common to have voice changes due to a cold or allergies, but if your voice has been hoarse or noticeably different for more than 2 weeks, it might be a sign of throat cancer. This happens because the cancer cells can affect the vocal cords. If you notice such changes, it's crucial to consult a healthcare professional immediately. Remember, early detection can significantly increase your chances of successful treatment. A voice change can be a clear signal. Do not overlook it. Trouble swallowing could indicate something more serious. If you've started to find it hard to swallow or it's become painful, this might be your body's way of telling you something is off. Difficulty swallowing can be an early sign of throat cancer. This doesn't mean to panic, but it does mean you should take it seriously. It's crucial to consult with a healthcare professional who can evaluate your symptoms. Remember, never ignore persistent swallowing issues. They could be a red flag. Ear pain, a sore throat, and unexpected weight loss can all be signs of throat cancer. Let's dive right in. Ear pain isn't commonly associated with throat cancer, but it can be a symptom. The reason is that the throat and ears share certain nerves, so a problem in your throat can send pain signals to your ears. If you experience persistent ear pain, it's time to consult a doctor. Next up is a sore throat. If you have a sore throat that doesn't seem to go away, it could be a sign of throat cancer. It might feel like you have a lump in your throat, or it might be difficult to swallow. Lastly, unexpected weight loss. If you find yourself losing weight without trying, it could be due to throat cancer. Difficulty swallowing can lead to a decrease in appetite, resulting in weight loss. Be vigilant about these symptoms. Early detection is key. Wheezing, swollen lymph nodes, and a high-pitched noise when breathing are all potential signs. It's crucial to understand that these symptoms might be more than just a common cold or allergies. Wheezing, for instance, could be due to obstruction or narrowing of the throat, possibly caused by a tumor. Similarly, swollen lymph nodes in the neck can indicate your body is fighting an infection, but they're also one of the first places throat cancer can spread to. Now let's talk about the high-pitched noise, medically known as stridor. This might seem harmless, but in reality, it could be a sign that something is blocking your airway. Remember, these symptoms alone don't necessarily mean you have throat cancer, but if they persist, it's essential to see a healthcare professional. Early detection can make a huge difference in treatment outcomes. These signs might not seem serious, but they can be. Stay alert. Hoarseness, blood and saliva, and a lump in the neck are all crucial signs. Now, hoarseness that persists for more than 2 weeks could be an indication of throat cancer. It's not just about losing your voice after cheering too hard at a sports game. It's a noticeable change that doesn't improve. Next, we have blood and saliva. This is not something to take lightly. While it could be a result of something as simple as a minor gum injury, consistent occurrences should raise a red flag. Blood and saliva could indicate a tumor in the throat that's bleeding. Lastly, a lump in the neck. This could be a swollen lymph node, often a body's response to an infection. However, if it doesn't go away, or is accompanied by other symptoms, it could denote a more serious issue. If you notice any of these signs, don't hesitate, act swiftly. Contact your healthcare provider immediately and get the necessary checkups. Prevention is better than cure. Let's explore how to prevent throat cancer. Lifestyle changes are often the first line of defense. This includes quitting smoking and limiting alcohol consumption, both of which are significant risk factors for throat cancer. Eating a diet rich in fruits and vegetables is not only good for your overall health, but it can also reduce your risk. Regular exercise is another key factor. It's not just about shedding pounds, but also about boosting your immune system, which in turn helps ward off cancer. The HPV vaccine is also recommended, especially for younger individuals, as certain strains of this virus have been linked to throat cancer. Regular dental checkups can also help with early detection, as dentists can often spot the early signs of oral and throat cancers. These are just some of the steps you can take, but remember, each person is unique, and what works for one might not work for another. It's always a good idea to consult with a healthcare professional to discuss your specific situation. There are various resources available for more information, such as the American Cancer Society and the National Cancer Institute. These organizations provide comprehensive guides on prevention, early detection, and treatment options. Stay vigilant, stay healthy, and remember, early detection saves lives. Every symptom matters when it comes to throat cancer. We've journeyed through the 12 signs that could indicate this condition, from a persistent cough, a change in voice and difficulty swallowing, to ear pain, a sore throat, and unexplained weight loss. We've also touched on wheezing, swollen lymph nodes, and a high-pitched breathing noise, not forgetting hoarseness, blood in saliva, and a lump in the neck. Each of these signs is a potential marker, a red flag that should not be ignored. Early detection is paramount. It's the difference between a mountain and a molehill, a fierce battle and a manageable skirmish. It's the key to turning a daunting diagnosis into a success story. So, if any of these signs resonate with you, don't hesitate. Seek medical advice. Reach out to professionals who can guide you on this journey. Remember, it's not about fear, it's about empowerment. It's about taking control of your health and well-being. And while you're at it, don't keep this information to yourself. Share it. Pass it on. You never know whose life you might touch, who might be in need of this very breakthrough. So go ahead, share your throat cancer challenge in the comments. Tag a friend who needs to hear this. Remember, you're not alone in this fight. We're in it together, one step at a time towards a healthier future.